Pneumonia cases among children are reportedly on the rise in different parts of the world following an outbreak in China, where health authorities are actively responding to a surge in respiratory illnesses. So how severe is the situation in China? How are pundits explaining the rampant cases of pneumonia among children? And what precautions are being recommended? Hope your work week is off to a good start. You're watching Monday's edition of Issues and Insiders. I'm Min Sunhee. Today we address the recent surge in respiratory illnesses here in the region and elsewhere. For more on this, I have Doctor Kim Seung-taek from Institut Pasteur Korea here in the studio. Dr. Kim, it's a pleasure to have you with us again.
Good afternoon. Thank you for having me.
Right. I also have Professor Ben Cowling at the University of Hong Kong live on the line. Professor Cowling, it's great to have you on.
Yeah, good afternoon.
Professor, I'll start with you then. Let's begin with the situation there in China. How worrying is the surge in respiratory illnesses there?
Well, I think winter surges are always worrying. Lots of people get coughs and colds at this time of the year. It's happening in Korea as well, and it's never something very nice. But for the last 3 years, it hasn't happened so much because of the things we've been doing to prevent COVID. And so now that these coughs and colds are back, it takes some people by surprise, but actually we shouldn't be surprised. In China, I think it's taken some people by surprise, but actually it was very predictable that we'll have a winter surge. And I don't think the level of cases in terms of people with coughs and colds, in terms of children going to hospital, in terms of older adults going to hospital, all of those things I think is consistent with what's happened before the COVID pandemic.
Why then, Professor Cowling, would you say is China witnessing such a great prevalence of cases, if I may, at this particular point?
Well, if we compare the numbers of children in hospital at the moment with what happened in, say, 2019, 2018, 2017, it's not actually that different. There's not a much larger number this year. It's a similar number to what's happened before. But I think the difference is last year, 2 years ago, 3 years ago, this wasn't happening because of measures taken during the COVID pandemic, because of people's awareness about respiratory infections and their caution. And so now that these are back, these winter viruses, it does take some people by surprise, but I don't think there's any reason to panic.
Right, I see. Meanwhile, Dr. Kim, Korea itself, it's also witnessing its fair share of respiratory illnesses at this time in the season. How severe would you say is the situation here in the country?
Well, as the Dr. Cowling said, in the situation in China, in Korea is very similar. Probably the numbers are maybe just less than in the case of China. But we are seeing this surge of the respiratory illnesses, but this number is still just within the prediction level. I mean, when we actually compare to the numbers before COVID-19. Also, some infectious disease, the experts say maybe now we are just the surge is a little bit earlier than we actually expected, but still just numbers are within the prediction level. And then, as Dr. Cowling said, because of our the control measures during the COVID-19, now somehow all the respiratory infections other than the COVID-19 somehow were just suppressed and then controlled. But now there is just a surge in part because of the lift of all the mandate, where just mask wearing and then all the personal hygienes.
What about vaccination, Dr. Kim? Do you suppose that the national vaccination campaign perhaps was not taken up as effectively by members of the public?
Well, I don't know. I haven't looked at all the stats exactly, but I think still just Korean people are very mostly just volunteer to get vaccinated, although there was some doubt on the effectiveness of, especially in the past, the COVID-19 vaccines. But many people get vaccinated when they have a chance, COVID-19, also some flu vaccination. That might just maybe just affect to just maybe reduce the total number of cases.
Right. Professor Cowling, I hear pediatric pneumonia cases are also quite a cause of quite a bit of concern in China. And I hear health authorities there are linking this reality to mycoplasma pneumonia. What exactly do they mean?
Well, that's right. So winter infections, coughs and colds, are caused by a lot of different pathogens, mainly viruses, also in some cases bacteria. So the major causes of the surge in pediatric pneumonia, children with pneumonia in Beijing and elsewhere in China, the majority cause is influenza virus. respiratory syncytial virus, RSV, and some other respiratory viruses, and also this bacteria that you mentioned, Mycoplasma pneumonia, among other bacteria as well. And one of the reasons for the concern about this particular bacteria is the high levels of antibiotic resistance to one of the commonly used antibiotics to treat that infection. About 80% of cases are resistant to this particular antibiotic. And I have to say, it's not only the case in China. Actually, I looked up the data in Korea, and also the resistance level for that particular bacteria is about 80%, probably some shared pathways, perhaps because of the travel that's been going on in the past before the pandemic between China and Korea and elsewhere in the region. So it's a cause for concern because children get admitted with pneumonia, and then the doctors need to do the right kind of tests to know what kind of medicine to give. And also because the most commonly used antibiotic won't work as well, the doctors need to be on high alert to switch antibiotic if that becomes necessary.
And is this becoming an active campaign? Are doctors able to switch medications properly on time? And are they handling the situation in China as we speak?
Well, that's right, but it's never ideal if the first choice of antibiotic doesn't work, because there's reasons it's the first choice. So there are other choices, and now there's a lot of awareness about this particular bacterial infection in China and also elsewhere. So doctors are aware of it. They are managing the situation. But it's difficult, you know, when there's a lot of children in hospital, and I'm sure in Korea, there's a winter surge as well at the moment. I know there's a lot of flu in Korea. And so it's quite possible that you have in Korea a lot of cases of Mycoplasma pneumonia and other bacterial infections, which doctors need to monitor very carefully and make sure they're treated appropriately.
Right, of course. And before we delve into the situation here in Korea, Dr. Kim, media reports, as Professor Cowling has said, do talk about child pneumonia cases over in Europe as well. Could you tell us a bit more about that situation?
Well, the cases in Europe, and also there is some report in the United States as well. But some people say the infections by the Mycoplasma pneumonia. And then the things, what we have actually discussed so far, that this is not just a new things. And then, but one of the concerns is that as Dr. Cowling said, there are some the bacteria resistant to some antibiotics. So we have to be very careful to choose which kind of antibiotics we have to use. And also, so far, there are some WHO and others actually investigating whether this kind of this is not really unforeseen, but the things have. It's within still just prediction levels, but we feel this is a surge because during the COVID-19 pandemic, we have the numbers were suppressed. So the WHO and then some Chinese government actually also investigating some potential whether this pneumonia is due to by some unidentified new pathogen. But so far, there's no such just a report. All those this respiratory infection we have seen so far are caused by the pathogen we already just aware of.
Right. And what about the situation here in the country, Dr. Kim? What can you tell us about pediatric pneumonia cases here?
Well, based on the KDCA, especially focusing on the Mycoplasma just pneumonia, the numbers actually doubled up over the last month from the 126 to 270. But I think this is a number officially just confirmed by the KDCA. But there are other pneumonia cases caused by some other. This is the Mycoplasma. This is a bacteria, but there are other the causative agents, including many just viruses, including like COVID-19, and then the rhinovirus, adenovirus, influenza virus, and then RSV. So in this case, we are not actually just monitoring and diagnosing all those cases caused by the viruses. So the numbers we are actually seeing is probably some underestimate, but I think but still just within the some prediction levels that we are actually within just some control.
Right, I see. Professor Cowling, could you tell us a bit more about the pathogens that cause pediatric pneumonia?
Well, the major ones are viruses: influenza virus, respiratory syncytial virus, and then a bunch of other respiratory viruses, which we group together and call common colds. Usually they just give you a cough, a sore throat, but sometimes they can be more nasty. Sometimes they give you a fever, and sometimes, particularly for younger children and for older adults, they can lead to you getting into hospital. And then we also have another group of pathogens, the bacteria, a bunch of different bacteria. I have to say, though, that most bacterial pneumonia cases may well be triggered by viral infections first. So you get a virus like influenza, and then the bacteria come in as a secondary infection, and then you get the pneumonia, and that's how some people end up in hospital. We can prevent influenza with influenza vaccination, and I know the vaccination coverage is very high in Korea, not so high in many other parts of the world. But the other respiratory viruses we can't really prevent with vaccines, so we have to think of other ways to limit their spread. Having said that, before the COVID pandemic, we didn't do a lot about respiratory viruses. We have winter surges every year. They're kind of predictable. We don't know exactly how big or how small they'll be, but we know there'll be a winter surge every winter. But usually not very much is done to mitigate it or to slow the spread or to reduce pressure on hospitals.
Right, I see. Professor Cowling, what more can you tell us about the classic symptoms of pediatric pneumonia that perhaps parents need to keep in mind?
Just if your child's starts with a respiratory infection, usually maybe a fever, maybe a cough, maybe some other respiratory symptoms, maybe can't sleep at night, maybe just feeling generally unwell. After a few days, it typically resolves with common cold, and usually there's no need to seek medical attention. But if there's a high fever that lasts for longer, if the child's showing symptoms that they might be having trouble breathing, that's really the worrying sign that means you should go and see a doctor, even go to hospital more quickly. I mean, I'm not a medical doctor, I should say that. So maybe the other colleague in your discussion can comment, but just follow medical advice, basically. Most respiratory infections resolve without any need for treatment, but sometimes, unfortunately, they don't go away by themselves.
Right. Dr. Kim, given these latest developments, do you suppose travel this Christmas should be avoided, generally speaking?
Well, I think, even just during the COVID-19, depending on the country, all the different countries actually take some different some precautions. Well, I know just recently Taiwan has actually issued some travel advisory for like a travel advisor against the traveling in China. But this is some kind of some extra precaution that some country can take. But other than that, I think just practicing just a good personal hygiene is much more important. For example, including just wearing masks and then washing hands and avoid some crowded places, and then maintain a good just ventilation, and also a very good prevention strategies to get vaccinated. And now we have the very good vaccination, especially for COVID-19 and the influenza. And I don't know, the RSV vaccination is quite just, how many just countries are actually just administering RSV vaccination. But just this year, the two very effective just the vaccines against the respiratory syncytial virus, that's the name for RSV, are now available, developed by some GSK and the Pfizer. So if if you feel that some vulnerable people, like very young, just adolescent, just a very young, or like a very elderly people, just vaccination is actually very good just strategy to preventing especially at these the three different very notorious infectious the viruses.
Right, Professor Cowling, what has been the response to vaccination in Hong Kong, China at the moment with regard to flu concerns?
Well, flu vaccination is higher in Hong Kong than it has been in the past, because just a few years ago, we started school-based vaccination. That means going to primary schools mainly and administering flu vaccines to the children whose parents agree to that. So whereas maybe 10 years ago, almost no school-age children in Hong Kong would get flu vaccination, now it's about 60%. So it's very high with school-based vaccination. It's a very efficient way to do that. Overall in Hong Kong, we only have about 15 to 20% of people getting flu vaccination every year. I know it's much higher in Korea. In mainland China, it's very low. Only a few cities offer flu vaccination programs, Beijing, Shanghai, Chongqing, maybe a few others. And even in those places, the coverage is not very high. So population-wide, it's really a missed opportunity. If they used more flu vaccine, they would definitely be having less flu.
And keeping all that in mind, Professor Cowling, what precautions then should relevant authorities within this particular region, of course, seek to take to ensure an effective response mechanism?
Well, I would say two different things we can think about. So firstly, the winter surge is going to happen. I don't think we can stop it unless we want to go back to the situation during COVID. I don't think there'll be much appetite for those kind of stringent measures. So the only thing we can do is to slow down the winter surge, and reduce pressure on the hospitals, particularly reducing the peak pressure, which is the biggest concern. Usually, if there's too many people that need to be admitted to hospital all at the same time, that's a problem. So we can slow down transmission, we can reduce the spread of infections. The two things I want to talk about, firstly, from the government level, that's top down, and secondly, from the individual people in the community, that's bottom up. So firstly, from the top down, we know what kind of recommendations would make a difference. Things like encouraging people to wear face masks in public transport, encouraging people to stay further apart from each other if they can, physical distancing, sometimes called social distancing, and maybe look back at some of the other recommendations during the COVID pandemic. I don't think we'll see mandates anymore, but maybe recommendations would be helpful. And then from the bottom up, from individual people, we can all do what we can to prevent us getting infections. So that means being careful about where we're going, maybe wearing a mask on public transport out of our own choice, washing our hands a little bit more often. And also, if we do get a respiratory infection, keep it to ourselves. Stay at home, isolate until we're feeling better. But I know a lot of people have trouble isolating. They have to go to work. They want to power through their cough or cold. And ultimately, that means that the infection spreads and other people get it, and it just propagates through the community. So those are my suggestions.
Right. Dr. Kim, Professor Cowling spoke about the pandemic, and keeping that in mind, what do you believe are the prospects of another pandemic in the near future?
Well, it's hard to tell, but according to all the stats and then the things, background so far, well, the chances are much higher than ever before, because this is mostly due to the human behavior. Well, the nature and then these pathogens are still there, but our human behavior somehow just promote the chances of just future pandemic or just epidemic. And then this, if there is any just future pandemic or epidemic occurs, this would be the genetic origin, which is actually occurs between the some human and animal interfaces. And then what I'm saying is the human behavior is that, for example, like some urbanization and deforestation, and then global climate change, or just a very frequent air travel, that everything actually just somehow contribute to just increasing the chance of just a global outbreak, the situation. So in prepare for this kind of a global pandemic or just epidemic, there are three just aspects that we actually just think about. The first one is the prevention. And the second one is preparedness, and the third one is response. And in terms of prevention, now this is the case I just talked about. There are currently something is going on in terms of all due to by the human behavior. So then we have to think about how we can actually effectively reduce this kind of human behavior to promote the future global or the regional outbreak. And the next one is preparedness, which we probably say like preparing by developing in advance for like a vaccine, some future vaccine platforms, or like some drugs, which probably for example, like some broad spectrum antivirals, and then some more advanced diagnostic system as well. And then for the responses, well, just in case of some pandemic or just outbreak, where all the government and then some global community and all pharmaceutical or some private sectors somehow just collaborate to just contain this outbreak, very small cases, under the response very immediately, and to effectively stopping further spread, and also implementing vaccination and the diagnostics, the vaccination, also some treatment.
And speak about vaccination, Professor Cowling, do you suppose, along with, of course, the precautions that you mentioned earlier of how you need to wash your hands, wear your face mask, and of course watch your distance from bottom up, would you also recommend getting your COVID-19 vaccination if you haven't done so for a long time?
That's a good question. I think for flu vaccination, it's very clear that every year people should get their flu vaccination. For COVID vaccinations, there's a debate now in some countries about which age group should be prioritized for COVID boosters. If you remember, a year or 2 years ago, we were recommending that everybody gets their booster. Now there's probably more of a focus on older people to get their COVID boosters and to stay up to date. But for younger people, maybe relatively less focus. I would say it's a personal choice. If it's available, you can think about whether to get it or not. And for older people, I would definitely recommend they get the latest COVID booster when it's available. I'm not sure if you have the new XBB booster yet in Korea. If you do have it, I hope that a lot of people are choosing to get it, particularly those most vulnerable to COVID, the older people and those with underlying medical conditions as well.
Right, of course. And moving on then, Professor Cowling, how prepared, generally speaking, are our healthcare systems for perhaps another pandemic?
Oh dear. Well, I think unfortunately the COVID pandemic has weakened rather than strengthened our healthcare systems, and that's really unfortunate to think about. But I do think that we're in many ways in worse shape now than we were 5 years ago. And also, if there was to be another pandemic now or in the next few years, I mean, fingers crossed that won't happen. But if there were to be another pandemic, I think we'd have a lot of trouble thinking about how we'd respond to it, because people are so tired of what happened during the COVID pandemic. There'll be a lot of resistance to the idea of bringing back some of those restrictions, even if they're judged to be necessary. And so at the moment, I think we're in a little bit of a risky situation, but hopefully there won't be any pandemic. So fingers crossed for that. And then in the longer term, I think we really do need to learn the lessons from the COVID pandemic about how decisions should be made, how decisions can be made in future health emergencies. What can we learn about the decision-making processes? And I'm watching with great interest the public inquiry in the United Kingdom into the decision-making processes during the COVID pandemic, with the objective being not necessarily to blame one person or another, but to find out what can we do better next time? How can we design our political systems, medical systems to be more responsive and better able to deal with a future emergency? I don't know if there's going to be an inquiry in Korea, but it would be a great thing to do. It'd be really valuable to look at what happened during the COVID response and improve the system for next time.
Right, I would have to say that's a very productive approach to dealing with future pandemics then. All right, Professor Cowling, thank you so much for your time and your thoughts today. And Dr. Kim here in the studio, thank you very much for your insights.
Thank you.
Right, well, that is all the time we have for this edition of Issues and Insiders. Thank you for watching. See you same time tomorrow.